So, I'm in the med room right now. I just came from my patient's room. I confirmed name and date of birth. Her name is Millie Larson, and she's getting an insulin aspart injection. So, I would be looking at the Pexis. For insulin aspart vial, it's going to be in drawer 10. So, I'm going to grab that out, and then I'm going to go up here and grab my insulin syringe and needle. Okay, and then at this point, I would be doing my first check. So I made sure again, insulin aspart vial is in drawer 10. So right here, it's gonna say insulin aspart injection. This is 100 units. I know from my MAR that I'm gonna be drawing 10 units of the insulin. And this is for sub-Q use, which she is getting subcutaneously in her belly. And then I just wanna make sure that my syringe goes up to 10, just to make sure that it's all perfect there. While I'm here, I'm gonna grab 2 alcohol prep pads, and then I would log out of everything just to make sure everything's good. Now I'm gonna come over here to prep everything, taking my MAR with me and running it into a desk. And again, just I know insulin aspart injection, and I'm gonna set up all my materials here. So the first alcohol pad, I'm gonna put one back on my computer so I can take it back with me to the patient's room. I would clean the vial. Okay, and while that dries a little bit, I'm going to be opening my syringe. Perfect. Now I'm gonna hold, since this safety is one that pulls up, I'm gonna hold it down while I uncap it. Place the cap upside down like this on the table for easy one-handed recapping. Again, insulin aspart. Okay, perfect. I'm going to pull 10 units of air to inject back into the vial. Insert the needle, inject the air, hold it like this, and now I'm gonna pull my 10 units of insulin. I'm gonna pull a little bit more because I like to tap it out here to get the air bubbles out, just so the needle is not getting all bent up inside the vial.
I'm an MGB. I'll be doing the return demonstration for an IM injection. So prior to going into the room,
now one-handed cap like this.
Introduce myself to the patient. I already have 2 identifiers.
And again, this is gonna be my second check. So I'm gonna throw this out real quick. But this is gonna be my second check. So I have Millie Larson, which it says her name up here, Millie Larson. Perfect, perfect. And then again, she is getting her insulin aspart injection. Insulin aspart, this is 100 units in this vial, and then she's getting only 10 units, so I'm checking that again here. 10 units, that's perfect. Okay. Now I'm gonna come over here, back to my patient's room. I'm gonna knock. Hi Millie, it's Natalie. I'm back with your insulin injection. So, you're gonna be getting it subcutaneously in your belly, okay? Can I just get your name and date of birth again? Perfect, perfect. Okay, at this time I'm gonna do hand hygiene.
This is where I'm going to be doing my first check. So,
And then if I don't wanna lean over, I can raise the bed up a little bit. That's not always necessary depending on where she is. Okay, and then I'm gonna grab some gloves. Okay. Throw the gloves on like this. Okay. Now, this is going to be my third check now that I'm in the patient's room. So it's going to be insulin aspart injection, and she's getting 10 units, which is perfect, 10 units. Okay, cool. So that's going to stay there. So then I'm going to come over here. I'm going to use my alcohol prep pad. So I would give the patient privacy as needed by drawing curtains. Millie, so the injection's going to be on your belly, okay? When I'm going to raise your gown up a little bit. As I'm raising her gown up, I'm going to make sure to be covering anything that could have been exposed that shouldn't be with the blanket. Okay. I'm going to clean the area. And then I'm gonna let that dry. So, as I'm letting that dry, I would be scanning the medication as well as the patient. Let that dry. Perfect. Now again, I'm gonna be holding the safety just so it doesn't come up. The lid will go in the sharps container. And for subcutaneous injection, you want to grab some of the fatty skin. So you want to go to a more fatty area of the body, like the belly. So I would grab about 1 to 2 inches. So I'd say if I'm grabbing about 2 inches, you want to go at a 90-degree angle. So I'm gonna inject, holding the skin. Inject the medication slowly. Take it out, let go of the skin. At this point, I would have gauze just to clean the area, and then enact the safety. Throw that in the sharps container. Okay, Millie, you got your injection. Do you have any questions or anything? No? Okay, I'm gonna just lower the bed back to the lowest position. I would take off my gloves. Okay, Millie. Here's your call light and everything. If you don't have any questions, just use your call light if you need me. And then I would document the injection I just gave her.